Okay. Come in.
My name is Hannah, and I'm going to be your nurse today, so I'm going to wash my hands. What is your date of birth?
10/7/72.
I would look at her wristband to make sure that's right. What is today?
Today is Thursday.
And where are we?
We are at home.
Okay, so she's oriented to person, time, and place. I would be, throughout the assessment, just looking at her skin, any lesions or bruising or anything out of the ordinary. She's conscious. She's oriented. If she had any IVs or drainage sites or ports, I would also assess those. I would also be watching like her hip areas and places where she's more susceptible to pressure injuries and bony prominences throughout the assessment. So next I would put on gloves and I would explain to her that I am going to feel her head and face and I would also educate her that I'm doing a head to toe integrated assessment on her just to make sure she's okay. So I'm going to touch her head. I would just be looking for any lesions, feeling for any masses or anything, infestations. Her hair looks thick, it's long, clean, so there's nothing wrong there. I would also inspect her face, and while I'm doing this, I'm looking at her skin and making sure there's no bruising or skin breakdown. I would be looking at symmetry. She's equal on both sides. I would have her smile, frown. Are you frowning? Puff your cheeks out, raise your eyebrows, and tightly close her eyes. And that is just testing her cranial nerve number 7, the facial cranial nerve. So next, I would palpate her temporal arteries for elasticity. So, and her temporomandibular joint. I would just have her open her mouth, close her mouth. So it seems like she has full range of motion there. So next, to keep going on her face, I would look at her external eyes. I don't see anything wrong, scarring or skin breakdown there. So I would ask the patient, do you wear glasses or contacts?
No.
Do you have any problems with your eyes?
No.
Okay, so then I would just test her pupils. I would have her look over my shoulder. I'll use my pen light. Watch my pen. So her eyes are perla, pupils are equally round and reactive to light and accommodation. Next, I think I'm gonna go to her ears. So I would just feel her ears, the tragus, the lobe, look at her ears, nothing abnormal. Then I'm gonna do a whisper test on her to assess her hearing, if she has any hearing loss. So I would stand a foot or so behind the patient and whisper 2-syllable words, and if she can repeat at least 3, then she should be okay. So I'm gonna do that. And she would cover one of her ears. So we're just testing, and if it was the other ear, she would cover this ear. So
66. 23. 16.
Okay, so she did 3. Pretty good. So next, back to her face. I would ask her if she's been having any problems with her sinuses or nose.
No.
Okay, so then I would just lightly palpate her sinuses and nose. Also just looking, making sure all looks normal. I would also see which airway is best for her through her nose, so I would occlude one of her nostrils and have her blow out. Sticky. And ask her which one she felt better that the air came out of.
The left.
Okay, so next I'm gonna look at her mouth and throat. I would still have my gloves on. I would be looking at her lips, her cheeks, teeth, gums. I'd be looking at the mucosa. Should be pink and moist. So I would also look at her hard and soft palate. I would have a tongue depressor and I would look at her uvula. I would gag her and watch her uvula to see how it reacts to that, and that's cranial nerve number 5, trigeminal, and then I would also use a tongue depressor and test her tongue strength, which is cranial nerve number 6, her spinal nerve. So it's basically all in your mouth. Next, I would assess her neck. So I would have her move her neck, as much as she can. Looks pretty good. Which is assessing her range of motion. I would palpate her lymph nodes, her trachea, her carotids, and her thyroid. And if her thyroid seemed enlarged, I would auscultate the thyroid and listen for any bruits. So next I would do her upper extremities. I would just be looking, feeling temperature, skin breakdown, hair distribution. All looks good. I would have her shrug her shoulders with resistance and move her face against my hand with resistance. And so that is just testing the cranial nerve number 6, which is the spinal, which is also the tongue strengthening nerve as well. So then I would have her bend her elbows, turn them. I'd have her do her wrists, fingers. I would also feel her epitrochlear lymph nodes in her arms, see if they feel enlarged. So then I would be feeling her radial pulses. They are strong and equal bilaterally, as well as her ulnar and her brachial. And I would also be doing this on her bare skin, but I don't want to expose her. So I would also just see if she has sensation in her arms. So can you feel that?
Mm-hmm.
She does have sensation in her arms. So next I would look at her chest. I would just make sure it looks equal, no skin breakdown. I would also be watching her as she breathes, noting if she's using any extra muscles. So then I would auscultate her lungs in the front, her anterior lungs, and 10 points. So I would have her breathe in every time I move my stethoscope. And like I said, I would also be doing that on her bare skin, but I don't want to expose her on the camera. So I would also have her sit up, and I would be looking at her posterior lung area. I would also look at her back for skin breakdown. I would feel her spine for any scoliosis or spinal curvatures. Also, when I was doing the front, I would test her skin for tremor, so just a little pinch, and I was like 1.5 seconds, which is good. I would also take her anterior lungs and 18 points, so I would just have her breathe in every time I move my stethoscope. Okay, So that looks good. So I would have her sit back if she wanted, whatever she was comfortable with. Next, I would palpate the areas for the heart. So like the aortic area, the pulmonic area, just those areas I'm gonna auscultate. And next I will auscultate them. So I would start on her right side in her second intercostal space, and also these areas are not actually the areas of the aorta. It is just where it's best heard. So I would go ahead and listen to the second intercostal space on the right, her aortic, and her second intercostal space on the left, her pulmonic, and then go one intercostal space down to the Erb's point. Then I would go to the tricuspid and the mitral. And I would do that on her bare skin. So, all sounds good there. I would have her lay back. Explain that I'm going to assess her abdomen. So first I would just look at her abdomen. It would be her bare abdomen in two spots, just for distension or anything, bruising, scarring. So, let me just lift you. I'm gonna auscultate her bowels, starting in the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. Okay, I'm also gonna lightly palpate her bowels, starting again in the right lower quadrant with one hand. I would also listen to her aorta for bruise with the bell of my diaphragm. And back to the heart, I would auscultate all those areas over again with the bell of my diaphragm. So I'll do that again. Okay. So next I would test her for appendicitis. So I would do the psoas test. So I would have her lift her leg up and bend it and push against the resistance on my hand. If her stomach hurt, that's maybe a sign of appendicitis. I would also do the Rosvos test. So I would push on her left lower quadrant, and if she felt pain in her right lower quadrant, that might be a sign of appendicitis. So next I'm gonna assess her lower extremities. I'm just gonna look at her legs for the skin color. I would maybe feel for temperature on both sides, edema. I would have her bend her knees, maybe push her legs out to see her range of motion in her hips. Look at her legs, feet, and ankles, just kind of maybe feel them. Make sure that it all feels okay. I would test her capillary refill on her toes, but she has toenail polish on. So I would have her do the heel to shin test for her fine motor on both legs, so she does good. For sensation, I would also pull her toe up or down and have her close her eyes and guess which way I'm pulling her toe. So, and then for my neuromuscular skeletal portion, I would have her stand up I would assess her gait, so have her walk a few steps. Okay. I would have her tandem walk 1 foot behind the other. She doesn't do too bad with that. I would have her do the Romberg test, so I would have her stand with her feet together, arms by her side, close her eyes, and if she significantly swayed, she would fail. Or pass, I guess. It would show that she has something wrong with her gait. And then I would have her do finger to nose, which she can do, which is good. And then I would have her sit down. And that would be the end of my integrated head to toe. I would ask her if she's in any pain.
No.
I would ask if she needs to go to the bathroom or get up or help with anything.
No.
I would give her her call light, and I would tell her I was done with the assessment.
Thank you.